who determines the number of kids to have in a relationship? Who should determine that?
You're listening to Blue Radio, bringing the vibe.
Hata ukienda katika vituo vya hospitali, most healthcares wana advise watu kutumia the long term because ni non-hormonal. Kuliko hizi zingine the short term kama depo. Ambao depo most cases mtu ukishadungwa hiyo inachangia sana mtu the infertility. Ina take time. Mostly inaenda for 15 months. Kabla ushike ujauzito, ambapo ndio watu wanasema family planning si mzuri. Lakini unlike the other long term family planning methods kama coil, ukitoa tu hivi for 2 weeks then you are ready to get pregnant. Yeah, I think it's how they react with the body.
So unasema kwamba hizi reversible ziko na specific people yenye inawaletea harm, wenye wana react nayo positively na wengine wana react nayo negatively?
Yeah, naweza sema kuwa it depends with your body. Na most cases hizi the short term ndio zinakuwa, unapata mwingine amesema mimi nimetumia depo kwa muda mrefu sijasikia madhara yoyote. Na kuna mwingine anasema nimetumia depo lakini haijanifaa.
Alafu pia kuna kama hiyo kopa, mtu akiingizwa hiyo kopa ndani ya mwili, kuna venye inaweza react na mwili yako. Na kuna mwingine akiingizwa ako tu sawa.
Alright. Pengine labda uendelee tena kutueleza the other methods of contraception that are available. Sasa tumezungumzia hizo zenye ni reversible, alafu nasikia umezungumzia kuna long term, alafu kuna short term. Hakuna instant.
Hakuna.
Pengine utuendelee kutupatia the other methods that someone can use.
Okay. So tumesema kuna reversible na kuna short term na long term, alafu tumesema kuna permanent. Permanent sasa ni hiyo mtu akiamua ndio hivyo, maisha yake yote itakuwa ni hivyo. Kama vile tubal ligation ni ya wanawake. Ile ni zile tubes zako, fallopian tubes zinakatwa ama zinakuwa sealed, ambapo hata the sperm cannot meet in the fallopian tube. Na kuna ya wanaume inaitwa vasectomy, ambayo ina involve wanaume kukatwa ile ama ina block ile vas deferens, zile two tubes zenye zina carry the sperm to the penis. So hizi process mbili zikifanyika inamaanisha mtu maisha yake yote hataweza kuzaa. That's why inaitwa ni permanent. Yeah.
Now according and forgive my ignorance, according to your data and statistics, what methods do people opt for the most, and how effective are those methods?
I can say from the data most people go for the depo, the short term family planning method. I don't know, it's for the fear of the long term, because the long term takes 3 years to 5 years or even 10 years. Unlike the short term, which goes for 3 months, then you come back for the other injections or the implant. Or you can also use the condom for the short term. Yeah.
All right. Inakuwa nzuri tena sana. 9:09 in the morning, a very heated conversation. I know a lot of gentlemen are learning a lot out there. Thank you Shirley Wandera for listening in. We'll be sampling your feedback in a moment's time. But in the meantime, I want us to go on a short musical break. When we come back, we want to understand what are some of the barriers to contraception and family planning. Does religion have a role into it? Does society, dictate how family planning rolls out? Well, stick around and stick by us. We'll be getting into that in a moment's time. Tunasemanga vipi on the breakfast vibe? Mchezo ni ule, wachezaji
ni wale, formation ni ile.
Na kwa nzuri tena sana. If you're locking in, karibu sana to the breakfast vibe show. Now, this coming Friday, the Social Health and Insurance Fund will be taking effect. If you're 25 and above, says serikali inasema ya kwamba you have no choice in the matter. You have to contribute 2.75%, yes? And I want to start this segment with that particular question. Does or rather should the Social Health Insurance Fund consider family planning in one of its arms, for lack of a better word? Yani kwa hiyo fund, should they allocate monies you know,
For the
for family planning
methods and all that.
Yeah, that is one thing. And then the other day I was going on my social media, and then there was a nurse alikuwa na Twitter akisema if you know there is going to be amendments in the health sector, there is something called Linda Mama and something like that. I don't know if it has to do with family planning or how it helps the whole scope of you know, family planning. Could you maybe talk to us about that? How is it important to incorporate maybe funds in the social health insurance fund to educate, to like we were talking off air, to provide maybe CDs for young people in institutions, having campaigns and that kind of thing? Acha nianze na wewe karibu yangu hapa.
Okay, my answer will be yes. Because as much as we can't deny that young people everywhere who are sexually active, they do sex. And it is very important to educate these people, you know. And we educate them on these family planning methods. And also, if a person is young, we advise them on abstinence, right? And when you talk of funds, we talk of funds in terms of educational seminars, you know, in the universities. We need funds to that. We also need funds to have those contraceptives in schools, like condoms in the toilets. They're supposed to be there, you know, since you cannot say that there's no university student who is not sexually active. So akipata hapo kwa choo anaweza kuitumia instead of using raw sex ambayo itamfanya ashikwe na hizi HIV ama STIs for future, you know. So I think yes, it should be in the amendment.
All right. Inakuwa nzuri tena sana. Your views on the matter?
I'll still support the same. It's good because it also help in the health sector. There's a time kulikuwa na uhaba wa condoms, and also the short-term family planning methods ni depo, which really caused many people getting pregnancy or unintended pregnancy where they haven't even planned. So it's high chance the government should consider the funding so that there could be sufficient contraceptive in the facilities, and also supporting the health sector in large, where we have Linda Mama, we have family planning, we have the NC and so forth. Yeah, I think I really support that the government should really consider funding in the health sector.
All right. Madaktari wanasema sijui ni Friday ama lini watakuwa wanaenda on strike, eh? And I want us to talk more about barriers, you know, when it comes to, you know, family planning and this kind of thing. For example, now sasa madaktari wakienda strike, nani watakuwa na administer, you know, family planning? How would this affect, you know, the whole process? And what are some of the challenges that, you know, you face when you try to educate, you know, the masses and the public about family planning? Does religion have a say so in it, especially looking at the context where we are right now? Let's say in Mombasa, does religion have a factor in it?
I can say the barriers, and most of the barriers are like cultural norms and also religion norms, where most people look at family planning or contraceptive as a bad maybe initiative, in terms of I think it's also the misconception around what people are saying about family planning that also makes people think that family planning it's not good for young people or for even women in large. So I feel like it's high time to like also we have to sensitize more and also advocate more for this information I think for young people and also people in the community to really understand the importance of family planning. Yeah, and also I just want to say something on the strike. I think the strike will really affect people, mostly those who will be going to the facility maybe to seek for sexual reproductive services, which are sexual reproductive services kama family planning, the NCs and the clinics. It will really affect them because maybe somebody was referred to the facility for the depot family planning, akienda kule anapata hakuna watu, na maybe amekuja maybe the 3 months zimeisha, so he's supposed to also get the apewe tena the 3 adungwe tena the depot. So akifika facility apate hakuna madaktari, it will really maybe affect that person, because maybe this is a government, it's offered for free. So it's watu wengi wana prefer kukuja kwa the government facility because it's offered for free, unlike for the private sector where it's chargeable. So you find most people are coming for family planning kwa facility, so wakienda strike it will be very difficult. Hapo ndio utapata mama amepata ujauzito bila kupanga, maybe the family planning iliisha, so amekuja facility hajapata usaidizi, so na baby hana hiyo pesa kwenda the private sector, anarudi nyumbani. So akikaa paka madaktari wakuje, tema narudi anapatikana kwa mjamzito.
Lakini si ni baraka ama. All right. When you're dealing, with people your age, what are some of the barriers you face, when trying to communicate or advocate for family planning and this kind of thing?
I'll talk of
While you gather your thoughts, your thoughts. Sometimes when you talk about access, let's say a young girl ako in her high school thereabout. There is always first of all we could talk about poverty. Maybe I'm not financially able, maybe to go to the hospital to access such a service. I cannot communicate maybe to my peers that maybe I need this kind of assistance and this kind of thing. How important is it to incorporate education, and more so sexual education in high schools, institutions of learning? Because sometimes hata ule mwenye ako campus labda hajai have your conversation na wanasemanga having the talk, and in Africa, this is Africa, your parent can never take that time to tell you, this is ABCD, this is that. How important is it, for such education to be there? And what steps, are you guys taking to ensure the public is educated on the same?
Okay, I can say comprehensive sexual education is really important in schools. We are going to schools to educate these young people or young girls on abstinence, that they should abstain. Abstaining is also one form of family planning method. So we're educating them to abstain until the right time. So for the community, most of them we give them a correct information, because people out here don't have the accurate information about a sexual education. So you find people are misleading, or peers are misleading each other because they don't get, or they don't have the correct information. So our aim is to educate young people out here or in community or society that they get the correct comprehensive sexual reproductive education, so that they also can make informal decisions in what they will need in future, or which kind of family planning they will prefer. And also to understand there are many factors like STIs, how are they even transmitted, HIV, how is even transmitted. Also encouraging them to abstain, and also take cautions when they engage in sexual.
All right. Sometimes there is a fear, if I use maybe a certain type of family planning. Kwanza, there's a common one, and a friend was telling us when you use family planning unanona sijui what happens. Maybe could you break down some of the myths that are attached to family planning and yes.
Okay, I know of one. Ile periods kustop kabisa. Which is true. When you use family planning, it somehow interrupts with your monthly cycle. There's also hormonal changes.
Okay.
Yeah, you start having different types of hormones changing, like mood swings. So yeah, the contraceptives have side effects. It's not wrong. It's true.
And now, when you talk about side effects, when you go now to the hospital, because I think there is the need, for something like this to be kept very open. Unajua nikija kutry ama nikija consult, I'm supposed to be informed that what, these are some of the effects you could experience, or these are some things that could happen. In your research or in your experience, is this information provided when you go to health facilities or when you interact with doctors and nurses?
Yes. For example, the IUD, the one that is long lasting, the doctor cannot just decide to keep for you IUD in your vagina without any information. It's long lasting. It stays like even 5 years. So the doctor has to tell you the effects, tell you the time and how long you're going to use that contraceptive, and also how long are you supposed to stay with it. If it's 5 years, after 5 years you're supposed to go back to the hospital for if you want another one, or you want to use any other contraceptive. The doctor has to tell you every information. It's you to decide also on which one, but the doctor will give you advice and also will tell you about the side effects that are there. Yeah.
All right. Pengine niulize tu, unajua kuna michakato pia mingi huwa tunafanya kusikia huko tetesi, na they are saying that they've got natural methods of contraceptive. Is that true?
Yeah, the natural method of contraceptives. Kuna hii you count your days. It's tunaitanga menstruation cycle. You use the natural one. There are the beads which you count them, or you also use a calendar where you count your days and also the safe days. So when you're on your safe days, you can have unprotected sex and you don't get pregnancy. So I think it's only that which it's a natural a method of family planning. Yeah.
Pengine sasa tuzungumze on a perspective of bringing the man into the picture. You see, as we were talking, there's something you talked about, like how do you initiate the male gender into the contraceptive idea itself, because toka jadi, toka zamani, toka mambo na family planning yanze kuzungumziwa kwa jumla kwa society at large, inakuwa driven straight specifically to the female gender. So now that with the change of times, how do you bring in the male gender into the idea of contraceptive and family planning? Na pengine pia ni swali ambalo nitakuwa nauliza on behalf of somebody. Namuona Victoria Songa alikuwa anauliza like, mimi mwenyewe nataka kujishughulisha na hii swala la contraceptive. Like the question is, how do I bring my partner about in this story of contraceptives?
Okay, I can say I think the system brought up the family planning as a woman affair, where men stayed out of it, and they thought that this family planning thing is for women. So, but it's high chance that we empower these men and also make them understand that it's good for them being the leader of the house to also make a decision whether to also be involved in the decision where the partner wants to go for the family planning method. So the man also get to understand that my wife or my partner is wants to have this kind of a family planning, and have to understand which kind of family planning will be very suitable for him or for her, sorry. And also this also makes the woman feel very supported when maybe you walk in with your partner to go and consult about a type of family planning you want to use. So it's I feel like it's good for men out here to really understand and also support their wives or the women on matter of family planning, because it's not about the woman, it's also about the family, and you, a man as the head of the house, also being considered, and also make an informed decision, also understand this type of family planning, because kuna hizi tetesi kuwa bibi akishapata family planning akikuja nyumbani maybe amekuwa mchovu. So if the husband you don't understand, you utaanza kusema wewe mbona wanalalala nini na nini. So when the husband understand this, maybe these are the side effect that comes with the family planning that my wife has taken, because we understand that hakuna dawa ina side effects. Hata Panadol ukikunywa iko na side effect. Those are the normal side effects. So, and it's not a long term side effect. Ni ile tu ya siku mbili, maybe you feel headache, or you're tired, then you come back to your normal situation or states. So it's high time for men to also understand their women, also understand this type of family planning, and also get the information. And it's so nice when a man walks in with a wife wakienda ku inquire for family planning.
Yes, true.
And as much as we educate a woman, also we need to educate men. Men need also to know about all these contraceptives. Because let's say, for instance, they're in a marriage. When a woman uses the contraceptive, it affects the marriage, you know? So educating a man, when you educate a woman, also educate a man.
How do you mean affect the marriage? Kwani wataget divorce?
If she uses contraceptive without the man's knowledge,
it has to bring issues.
Yeah,
the conflict.
Yeah.
Pengine niulize hivi majuzi kuna kitu nilisikia mahali na ilikuwa pia kwenye mitandao ya kijamii na quite a number of news agencies walikuwa nasema kuna mbinu ambazo zimekuja za kuweza kusaidia mwanamume naye pia kuhusishwa kwenye hili swala la kupanga uzazi. Yaani yeye mwenyewe pia awe anatumia mbinu kadha wa kadha. Je, hizi mbinu ziko kweli ama zilikuwa ni stories hapa na pale tu?
Mbinu za
mwanamume kupanga uzazi.
Iko vasectomy pia ni mbinu moja ya wanaume kupanga uzazi.
Sasa hiyo vasectomy ni ile unafunga mchezo kabisa.
Unafunga mchezo kabisa.
Itakuwa ngumu.
Na hiyo wanaume hawapendi sana.
Obviously.
Hiyo itakuwa ngumu.
Hiyo inakuwa ngumu ya batiki ya.
Hakuna mbinu nyingine tofauti.
Hakuna maybe kumeza tablets or injection.
Kulikuwa na tetesi kuwa kuna tablets itatolewa, lakini bado hazijatufikia. Baby zikitufikia
so kwa hiyo paka muda sasa njia ya mwanamume kupanga uzazi ni hiyo moja ambayo ni ngumu.
Na condom pia.
Sawa, kuna hiyo.
Alright. Tunakuwa nzuri tena sana man. We're going to short break. When you come back, we'll be winding up. Any questions you might have for our guests, kindly direct them via our socials at Blue Radio Kenya. We'll be so glad to ask and inquire more right here on the show.
This is the Breakfast Vibe on Blue Radio.
Kwa nzuri tena sana, Mr. Easy bringing us to 10 in the morning. If you're locking in, karibu tena sana. Mala Kipto alongside
Mboya, your finest presenter.
And today we have two lovely ladies. Naweza sema 4 eyes ama ni 8 eyes in the building. Itakuwa?
Haiwezi kuwa 8. Kumbuka kwamba kuna mmoja ameongeza zingine 2 juu.
Mambo ni kama hayo. So the conversation we're having this morning is about family planning and the importance of involving young men, young women in this particular conversation. And as we wind up, I'd like to start with something that is very shocking. Ati mmesema P2
inaitwa emergency pills.
Yeah.
Zinafaa kuwa taken after how long na why is that?
Ni mara ngapi?
Kulingana na jina tu inasema it's an emergency pill, supposed to be taken twice a year.
Hiyo ni P2.
Hiyo ni P2.
twice a year.
Twice a year. Mostly it's in an emergency. So kama rape imetokea ama maybe you find yourself in a situation, then you're supposed to use the P2. But P2 it's not supposed to be taken frequently.
So we have literally been abusing
People
Yes.
are really abusing
the
Very
drug.
badly.
the drug.
So this is what we mean by drug abuse.
Yes. P2 si ya kila siku. P2 ni ya emergency. That's why it's called emergency P2.
So like what is the damage that might be caused if somebody consumes that drug frequently? Kama venye watu hufanya.
Okay, inaweza sema madhara ni kuwa infertility. It can cause infertility in future where maybe you're getting into marriage and you want to bear children, so you get a very difficult kupata mtoto. Sasa kumbe ni ile P2 ulikuwa ukitumia ukiwa ujanani. So if you want to kama unataka kupanga uzazi, there are many methods of there are many family planning methods you can use. Like in P2 it's only for emergency pill and supposed
cannot manage to have a family. Unaona? So in any education that pertains things to do with the family, Kenya umepitishia mwanamume pia pitishiwe the same way.
Au sio?
Yeah.
sure.
Alright, inakuwa nzuri tena sana. A time wanasemaje, muda umetupa kisogo. I like to give each of you 1 minute for your closing remarks, and more importantly, where can let's say any young person who wants assistance, who wants help in this particular direction, find you guys? They want to learn more, they want to be part of the program. How can they find you?
Okay. What I can say is we are located in Ziolangombe, CDP. We have an office next to a hall called Kikodep. It's where we are located, but you can find us as our handle CDP. It's Central of Development and Peace. So come, let's interact, let's learn from each other, and
All right. Your closing remarks?
Okay, today's topic was about family planning. So every girl should know the types of family plannings and the ways to use it, and the side effects also. And also for men, I think it's a higher chance we educate men also.
This is very clear. No one
It's
in
a
that
high
education.
chance. Yeah.
All right. Saruk, tumalizia.
okay, mimi nasema thank you so much for having us. It's a nice conversation. I think